Well, good evening, everyone. I want to welcome Dr. Fitzgerald back at our table today, and Minister Haggie will be joining us by phone from his home in Gander. So we will begin by turning it over to Dr. Fitzgerald for the update.
Thank you, Premier. Good afternoon. Thank you for joining us today. I'll begin, as usual, with an update on the number of cases in our province. Since the media briefing yesterday, we have 12 new positive cases. All of these cases are within the Eastern Health region. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province now is 195. By region, we have 186 in Eastern Health, 3 in Central, 1 in Western, and 5 in Labrador-Grenfell Health. Of the 195 cases, 143 are related to the Calls Funeral Home cluster. 53% of cases are female and 47% are male. By age, we have 15 people under the age of 20, 25 between 20 and 29, 31 between 40 and 49, 44 between 50 and 59, 42 between 60 and 69, and 38 who are 70 and above. 11 people are now in hospital due to the virus, and of these, 4 are in intensive care. 11 people have now recovered. In total, we have tested 3,201 people. There have been questions raised about the transmission of this virus when a person doesn't have clear symptoms. The evidence shows that in up to 90% of cases, transmission occurs when a person is symptomatic. And while viral infections such as COVID-19 may be transmitted within 24 to 48 hours prior to the development of obvious symptoms, the most recent evidence suggests that this may account for approximately 10% of cases. Some of the symptoms of COVID-19 can be mild, such as muscle aches and pains, and may not be recognized as the first signs of infection. We have used this information to inform our contact tracing, and we quarantine contacts who were exposed up to 48 hours prior to the symptom onset in a case. I would like to clarify some information about our online portal to retrieve test results. The portal in place to view your COVID-19 test results will show negative results only. If you have a positive test result, you will be notified by a public health official. This is to make sure that you receive the medical guidance that you need on how to treat COVID-19 at home, contain its spread, and if and when to seek further medical attention. Thank you to the 919 individuals who have looked up their online test results to date. This has significantly freed up time for healthcare workers to spend on contact tracing, and we strongly encourage people awaiting test results to access the portal online at gov.nl.ca/COVID-19. and clicking the link at the top of the page. Please note, it can take up to 5 days for your test result to appear on the portal. I'd like to take a minute now to speak about funeral services and gatherings. The protective measures and restrictions put in place during this pandemic have required us to alter our norms and to look for new and innovative ways to show our appreciation and respect for others. We have had neighbours make some noise to show appreciation for our essential workers, and first responders show their solidarity in support of our province's healthcare workers with drive-by parades. People have also adopted a similar approach for funerals, given that they can no longer pay their respects to loved ones and friends in the conventional way. We understand that people want to come together in this time of sadness and loss. We ask that you are safe when you do so. Please do not participate in the drive-by if you are in self-isolation or quarantine, and stay in your vehicle at all times. This is for the health and safety of everyone. Newfoundlanders and Labradorians are quite social on the whole, and for many of us, it has been a number of weeks since we have last seen our family and friends and co-workers. As difficult as it is for all of us, this is an important measure to help slow the spread of COVID-19 in our province. And as we head into the weekend, it is imperative that we continue to practice safe physical distancing This means staying home as much as possible and finding creative and meaningful ways to connect with loved ones, friends, and neighbors by phone or mobile device. Last weekend, it was nice to see on social media how people were transforming their usual shed parties and girls' nights to virtual gatherings. Apps such as FaceTime and Google Meet and Zoom are great for keeping in touch, and many are free and easy to use. I know what I'm asking you to do with regard to physical distancing is really difficult. The evidence is clear, however, that if we can reduce our interactions with those outside of our bubble, we can reduce the spread of this virus and in turn reduce the risk to those who are most severely affected by COVID-19 and reduce the impact on our healthcare services. It is estimated that on average, we interact closely with 11 people a day. If we institute physical distancing measures and reduce the number of close interactions to an average of 3 or 4 people a day, then we can significantly reduce the rate of spread and flatten the curve. For people not currently self-isolating or in quarantine, try to spend some time outdoors this weekend if you can. Go for a walk, do some work around your house, have a game of catch with your kids. If you do have to go out for essentials, please remember to keep your physical distance of 2 arms lengths from others and shop at off-peak times if possible. For those who are currently self-isolating, please know you are not alone. The Canadian Red Cross can assist you in accessing a wide range of supports and services. Please call 1-800-863-6582. The Provincial Warm Line is available 7 days a week from 9 a.m. to midnight. Call 1-855-753-2560 to speak with a trained peer support worker. Please remember that this self-isolation is only short-term and is helping to protect others. Thank you for doing your part. As a recap for those who may have just joined us, we have 12 new cases since yesterday's media availability. The total number of cases in the province is 195. The breakdown by health region brings us to 186 cases in Eastern, 3 in Central, 1 in Western, and 5 in Labrador-Grenville Health. Once again, I would like to offer my sincere gratitude to those who continue to follow the public health measures we have put in place. While it may not be obvious yet, I am confident you are helping to flatten the curve. Our collective actions will have a significant impact on how COVID-19 progresses in our province. Thank you.
Well, once again, thank you, Dr. Fitzgerald. Every day we do talk about physical distancing, and Dr. Fitzgerald just mentioned that sometimes maybe people get a little tired about the extreme importance of keeping 6 feet apart. Well, if you're getting tired of this, well, we will stop saying it when you start practicing it. For many of us, well, we feel healthy. Others, well, you may feel invincible, as if this would not impact me. Well, that attitude is irresponsible. That attitude towards others is ignorant. And it is extremely disappointing. In our society, we have a vulnerable population. Sometimes it would be our seniors. But it can also include children. And collectively, as a society, we have to do our part to protect them. Now, I've gotten thousands of emails. And from time to time, we get an email that will make us pause for thought. And yesterday, I received an email from a grandfather. His grandson, and I could use his name, was Jacob Anstey. Jacob is celebrating his 7th birthday tomorrow. He loves Star Wars, and he aspires to be a police officer. And so for most of us, we want Jacob to be able to live his dream and see his aspirations come to fruition. But at birth, Jacob had a congenital heart disease. His first surgery was done before he was 5 days old. He's had 3 pacemaker implantations. Jacob has overcome insurmountable odds. So I want to wish Jacob the very best. You give us strength. You give our society strength. So to your parents, Lisa and John, and your older sister, Georgia. I know that you will be celebrating as best you can in self-isolation. That's where you need to be at this moment. So we're not saying that Jacob is positive for COVID-19, but what we're saying is that Jacob is one of the vulnerable people that we have in our society. He is one of those high-risk individuals. So the actions that we're taking are to protect people like Jacob. He is a very real example. So what we're saying today is that our actions can save lives of others. It could save the life of your grandson or your granddaughter or a senior in our society. You know, information and education is important. It's empowering. So in an effort to support public awareness about the number of cases, about demographics, about those that are impacted in our society, today that we are not launching a new portal, it's at COVID-19 data. It's at our website. If we just visit gov.nl.ca/COVID-19. So just click on the pandemic update button, and it will direct you to a new dashboard, and you will see graphs, you'll see maps that contain information, important information about the total number of cases, the number of people that are currently in hospital, the number of people that are recovered, which is important, the number of tests that we have completed. So we are now into our third week. So there's a significant amount of information that are coming your way. We've put this in this dashboard. So the information is provided at the regional health authority level. That could be in Central, here at Eastern, and Western, and Labrador-Grenville. It allows people of all ages to gain a better understanding of where the virus has infected people in our province. It charts the rate of progress as we work to flatten the curve. It serves us as a reminder that we must not surrender to complacency. You see, complacency is our enemy in this fight. But this dashboard is launched by governments around the world. It's yet another tool to empower people with the information that is factual and trusted. It gives you the most up-to-date information of the pandemic and its impacts on Newfoundland and Labrador. The site is being managed by the people in our mapping division at the Fisheries and Land Resources, but it's in partnership with Newfoundland and Labrador Statistics Agency and in conjunction with the Centre for Health Information. So it is another great example of public servants that are working from their home and working with us to stop the spread of this virus. So visit the website. See, that is where you'll get the information, the most factual and reliable information that we have available to you. As Dr. Fitzgerald said, that we're now heading into another weekend. The evenings are getting longer. But maintaining the physical distance between us is the most important tool that we have. But it does not necessarily mean we have to keep social distance between us. And more than ever, we need to be there for one another. As Dr. Fitzgerald mentioned, this can be it can be a stressful time for many. So we can stay connected. Just do so, keeping and maintaining physical distance. Now, many people are doing this in many different forms. I've had many people that have reached out to me, and they've said that they are connecting with friends of the past, some classmates, people that were neighbors of those in the past. They are reconnecting. So we can do this in many forms. Some people are leaving notes. They're leaving groceries by people's doors. Some people are FaceTiming. They're using Skype, Zoom, and other social media platforms. But please remember, if you have any symptoms, even if they are mild, you must stay inside. Social contact can make you feel connected in a very stressful time. Don't be the conduit of COVID-19. It only moves if you move. Every bit of physical distance that you can keep with you and your friends can limit the spread of this virus. We will continue to work for you. We will continue to protect you and support you. The time is now. We are in this together. Let's be responsible. Let's take control of this so it doesn't take control of us. Thank you. I now turn it over to Minister Haggie for a few comments.
Thank you very much, Premier. Well, we've heard Dr. Fitzgerald give an update, and yet again we've seen another day-over-day increase. We have referenced our procurement challenges on multiple occasions, and I spent some considerable time last night on the phone with the Federal Minister of Health explaining our situation. I am of the understanding that we will expect a delivery of masks from Hamilton, hopefully later on today, and more deliveries of PPE over the period between now and the 10th of April. Whilst we have agreed to collaborate with private sector healthcare providers such as personal care homes and home support agencies, that will not allow us any leeway, however, to provide masks other than to people working in the healthcare sector. So for those private businesses who've approached us, we won't be able to help you out until we have an assured supply for our frontline workers in health. Dr. Fitzgerald has emphasized, as has the Premier, the issue of social distancing. The rationale behind this is becoming clear from models in other jurisdictions. Good social distancing delays the arrival of the peak. That allows us time to prepare. And as I speak, there are alterations in hospitals across the province to provide additional space for COVID-19 patients and adaptations to existing infrastructure to make their arrival possible. We've also got time to build up some kind of inventory of PPE so that we can meet the surge. Distancing also reduces the magnitude of that peak, the size of it. And what that does is it allows our hospital capacity to be able to cope. If we cannot delay the peak, it will arrive faster and higher than we can manage, and the system potentially could be overwhelmed. That is why we have spent the last 2 or 3 weeks emphasizing this business of social distancing. And yet still, as recently as last night, there were house parties. Again, the weekend is coming, and people will be tempted to revert to their old habits, go to the cabin and mingle in large numbers. This is not going to be to anyone's benefit. I've seen videos today sent to me by concerned citizens of seniors doing Zumba in rooms in close proximity. These are people who are adults and whose behavior acts as a model for our young people, and we cannot blame our younger people for behavior they see from adults who should give them a better example. We've talked about social media. There is a wealth of information out there about how to do it. It's one click away to be able to do these kind of activities in a group and yet physically distant. If we do not do this, one of these days Dr. Fitzgerald is going to come in and announce a sudden rise in numbers day over day, and this peak will take off, and we could be too late. The time is now. Our healthcare system houses our most vulnerable people. The Premier has given examples of this. I want to emphasize, however, that for those people admitted and for those people with COVID-19, at the moment there is no cure for this condition. The only treatment is supportive. It's not specific. There is no drug that will kill this virus within the human body. We don't have a vaccine yet to prevent it, and that is some months away, at best, and likely over a year. Our only option is the prevention of the transmission of this virus between individuals. The best tool in our toolbox, outside good personal hygiene, and Dr. Fitzgerald has emphasized that, our best tool, the one that's worked in other jurisdictions, is to keep at least 6 feet apart and cut down the number of face-to-face interactions anybody has with people outside their bubble to 3 a day and no more. The Premier said the time is now, and I've said that. But really we're getting to the stage now where, quite honestly, the time for us was 2 weeks ago. Each day we waste now will cost us. And that cost may not be personal and direct to us. It could be some friend. It could be someone we love. So for heaven's sake, stay in your bubble, stay home, and don't burst anybody else's bubble. Thank you very much, Premier. I'll hand it back to you now.
Thank you, Minister. We now open it up for the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. We will run through the telephone queue so each reporter has an opportunity And following this, should time permit, reporters can then ask single questions only. Operator, please proceed, as this call will end at 2:59 p.m.
Thank you. If you have a question, please press star 1 on your telephone keypad. And the first question is from Peter Cowan from CBC News. Please go ahead.
I've talked to a number of people who've had all the symptoms of COVID-19. One person even went to a doctor who said, yes, I'm pretty sure you have COVID-19. But when they went to get tested, they were told, nope, we're not testing people like that. If the World Health Organization says testing is one of the keys to know how many people we have the disease, to do the contact tracing, why aren't we testing everyone who has the symptoms?
So we have to let our epidemiology and our local context inform our strategies for testing and for contact tracing and all of that. We are analyzing that data on a daily basis, and if at some point we decide that that's where we have to go, then we will do that.
Peter, from a point of view of discussions at the federal level, one of the issues is about blood testing and looking for antibodies. That will tell you if a person has had the disease. The current testing we are using and we have access to, because that is what is licensed and available in Canada, is actually based on detecting the virus at the time someone has symptoms. So they are two parallel processes. At the moment, there are a series of test kits that are being marketed by a variety of manufacturers. Health Canada is looking at those because, quite frankly, some of them are not worth the effort of buying them. But once serology becomes accepted and available, that might answer your question to go backwards and say, well, did this individual have it? That, in actual fact, will not alter what we do on the advice of epidemiologists, because if you no longer have it, then you're not a risk to anybody else or yourself.
But if we're not testing these people, then isn't there a very real possibility that there may
Peter,
be way more
people? Peter, you've already asked 2 questions?
No, that was only my first question.
Okay, continue.
So if we aren't testing these people, doesn't that mean that we couldn't very likely have way more people who have the disease and may be spreading the disease because they haven't been tested, they haven't been ordered to quarantine, and we haven't done contact tracing?
You're talking about people who may have had the disease. Anybody currently who presents with their family doctor with an influenza-like illness, other symptoms to which you refer, would automatically get a COVID test on their ILI panel. So I think what you're doing is confusing past symptoms which have resolved with the current problem we're dealing with.
The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Some expecting mothers say they're terrified to give birth under the new COVID measures. Speaking to some of them, they are now, their support system has to leave within 1 to 2 hours. Scientific evidence suggests it's critical both parents bond with the baby at the time. What can you say to these expecting mothers?
It's a good question, Kellyanne, and we've had quite a bit of correspondence from my colleagues in caucus and also from concerned constituents. The facts of the case are this is around risk management. We sent out as recently as a couple of hours ago some further directives to the regional health authorities so their advice is consistent across the province. We did state clearly that a woman in delivery or in labour would be allowed to have one support person with them, and we have, in the light of your comments and others, extended that period to allow for some bonding for a few hours after birth. The problem is, at the end of the day, anybody who is interacting with anyone else is at risk of either contracting the disease or passing it on. Our newborns and mothers are vulnerable to a virus that is no respecter of age or condition, and so we feel, at the moment, given the seriousness of the situation, that this is a reasonable compromise between the two conflicting approaches that you describe. One of the bonding and this kind of thing. Bearing in mind the typical mom and baby would be going home sometimes as soon as 24 hours after delivery.
Thank you. And we've spoken heavily, or you've spoken heavily about a peak, about a surge, preparing for this. Do we have a closer timeline on that? I know Alberta's looking at end of April. We're generally behind the rest of mainland, are we looking at a time period for our peak?
We're looking at modeling. We are trying to now find whether or not we have a good model that we can plug our data into. That work is active at both the federal and provincial level. Certainly, we do know historically that we have lagged behind the mainland. I go back to my opening comments. If we have been successful with our our physical distancing, we will see the peak arrive later, and it will be a lower peak. If we haven't, the peak will come sooner when we have less time to prepare, and it will be significantly greater in terms of numbers, to the point where it could actually produce a significant challenge for our healthcare institutions, even with their significantly available bed numbers, in actually meeting the numbers.
Thank you.
Thank you. The next question is from Tyler Dunn from VOCM. Please go ahead.
Thank you. Dentists and other health professionals are wondering what constitutes an urgent or emergency service, as they are able to open if either should occur, yet they're unable to get clarification on what protocol to follow should either of these circumstances happen.
The decision as to whether or not a situation involving a patient is emergent, urgent, or routine is, and always has been, one for the clinician to decide. They need to satisfy themselves when they interact with a patient, or the letter is sent in from a primary care provider, that they have enough information to make that determination. Currently, we are still in a situation where anything that a clinician deems as urgent or emergent can be accommodated. Should we see a surge and the situation in the acute care facilities be stressed, that may then change.
And with banks still being open and whose workers are in close contact with the general public by handling items, cash, etc., what is being done to protect both those working in these businesses and those who are using them?
We have guidelines through occupational health and safety. Physical distancing is key. Barriers such as plexiglass and this kind of thing, at one time, were fairly standard in banks. They have gone, because of the kind of open office nature of new banks. The view is that we still need access to some banking services other than simple machines. We have challenges sometimes. People need to access their bank accounts. Their cards don't work. They need to be renewed. And we need to ensure that people still have purchasing ability. This state of emergency is going to last for weeks and months. So that is a crucial part of allowing people access to groceries, medications, and these kind of things.
Thank you.
Thank you. The next question is from Patrick Butler from Ratio Canada. Please go ahead.
Hi there. I have a question related to personal protective equipment. New Brunswick said yesterday they could run out of testing equipment toward the end of the week. How do we compare on the PPE front? And especially if we're talking about not being able to even provide masks to businesses such as personal private care homes.
Well, Patrick, that's a good question. PPE is a source of concern. Just to correct what may have been a misinterpretation of what I said, we will supply masks and PPE whenever possible to private businesses who provide frontline healthcare services. So that would include personal care homes. It would include home support agencies. What I said was we would not be able to provide masks to private businesses who might need it for the protection of employees not working within the healthcare sector. We do have some manufacturing capability starting up here. There is a challenge with PPE across the globe. In terms of that, at the moment, my staff advise me we have around a week to 10 days at the current rate of usage. And as I alluded to in my opening remarks, we are expecting deliveries today and through the week. The reagent issue for testing, we again have supplies that should last us up to our next deliveries, which are going to be the end of this week. So for the moment, unless something different happens, we are all right for the coming week, and we're working very hard to make sure we stay all right beyond that. But again, I must go back to the distancing. If people can seriously take distancing to heart, the the need for those reagents, the need for that PPE can be kept low for longer to allow us to build up a stock for when the wave does come, because it's coming.
And a question for the Premier. The Quebec government asked for the Army to come in and help in northern Indigenous communities in that province that would be grappling with the pandemic. Is Newfoundland and Labrador looking to do that, to have federal help in the form of the Army coming into northern Labrador communities?
That is not something that we've asked the federal government to do at this point. And going back and building on Minister Haggie's comments there, over the last day and a half or so, there's been quite a bit of dialogue and communication with other provinces, with other premiers, of course, and with our minister to minister in other provinces. And Minister Haggie's been a big part of that. Over the last day and a half, I think we spent quite a few hours, 3-4 hours, as premiers discussing things like PPE, as you just mentioned, and on a daily basis now we're getting updates on the equipment as it would arrive in Canada, arrive in Newfoundland and Labrador. That would be true for all provinces. So much of our discussion on a 2.5-hour call last night with the Prime Minister was about PPE, but it was also about other initiatives that we could avail of if need be. Bringing in the Army or using the National Defence, of course. But if we were to do that, we would have to make a request for a specific type initiative that they would come into the province for. So in Newfoundland and Labrador, we have not, this is not something that we see as an option or we would need at this point, but that option is available to us if we need it in the future.
Thank you. The next question is from Holly Mackenzie-Suter from the Canadian Press. Please go ahead.
Hi, Premier. I wonder if you can tell us what came out of the conference call with the Prime Minister, specifically on the issue of releasing models on COVID-19?
Yeah, so the two big calls yesterday, 2.5 hours with the premiers and with the Prime Minister and the Deputy Prime Minister. But prior to that, there was a call for about an hour with all the premiers. So very comprehensive, and modeling was part of the discussion. Of course, as the Minister has said already, that Newfoundland and Labrador, we do need more data to put in place what would be a very predictable or something that we have with confidence that we could forecast when this surge would hit Newfoundland and Labrador. So that would allow us to prepare, as the Minister said, for our healthcare, what's in our healthcare capacity to respond. But the most important thing, as we all said, is about physical distancing. That is how we best deal with this. So we see provinces now in very different positions. BC is at a modeling release. We know that Ontario will be releasing a model today. They're modeling for their province. We know that Saskatchewan, we were told on the call last night, would be early next week, Manitoba mid next week, and so on. So every province is in a very different position when they can actually put in place what would be a model for their individual province. But the fact is, the model will help us in preparation, but it's not going to prevent things from happening. We can do that today with the tools that we have, and that, of course, is physical distancing and complying to the guidelines that the Chief Medical Officer has put in place. They're important for us to work with our healthcare system, but the most important thing is what individuals could do to prevent the spread.
Thank you. And a question for Dr. Fitzgerald, just on the topic of contact tracing. I'm wondering if you could be a bit more specific about kind of the number of people that are working on contact tracing in a range of, dozens to hundreds on a given day, and what specific technology, such as apps or web-based systems, are being used.
So right now in the regional health authorities, there are communicable disease control nurses as well as public health nurses who are involved in contact tracing. Exact numbers I do not have, but certainly we are talking in close to 100 probably. But we and the techniques that are used, really, it's about it's old-fashioned detective work. It's asking questions, it's talking to people, and then that information goes into a database where all that information is kept. So it gets back to taking a good detailed history, finding out where people were, who their contacts were, and there's no technology really that can replace that. Although certainly there are some technologies out there that have been explored to aid in contact tracing.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Yes, hi. I wanted to follow up on previous questions regarding pregnant women. And so the local doula here has said that many mothers are saying to her that they're seriously considering doing home births that are unattended. What's your advice on that?
Again, that would be a matter of risk management, Peter. We do not have the infrastructure set up for home deliveries. That was something that was on the horizon distantly from the setting up of the midwifery program, which has only just started to roll out. I think one has to accept that the whole of obstetrics over the last couple of decades has been focused very much on risk reduction, and that has met with a lot of success based around hospital deliveries. It would be unfortunate, if someone escaped COVID-19 to have a major problem with a home delivery. And I think it would be incumbent on the mom to weigh that very heavily before trying that route.
Okay. And I have another question about distancing. There appear to be a lot of people, if you look on Facebook or other social media, they're traveling around the province visiting other communities. Some of them are not doing it for necessary reasons. Quite often they could be visiting. Is there any possibility that you might place further restrictions on travel within the province?
I think from a point of view of a public health issue, we would take guidance on that from Medical Officer of Health. But in actual fact, we've been very clear about travel. It is essential travel only. So if you're going to visit Granny, is it essential that you do that now? And could you do it some other way in terms of the social apps that we see that would allow connectivity? Quite frankly, if you look at some of the data that's come out of Google Mobility, for example, which is a few days old, it certainly suggests a significant reduction in travel across Newfoundland and Labrador, anything up to about even 30% in certain sectors. But you're right, Peter. People have got to ask themselves how important it is that we do this now. And the key is Dr. Fitzgerald's comment. If you can cut down per day the number of people you interact with to 3 or less, we can hold this disease to a point where the peak will arrive later and we have more time to prepare, and the peak will be lower and the hospital system can manage.
Thank you.
Thank you. The next question is from Elizabeth Witten from All Newfoundland Labrador.
Hi, I had a question, a follow-up from yesterday. Minister Haggie, you mentioned that testing is currently underway for locally made PPE, and I was wondering if these trials are successful, when could they be mass-produced and reach our healthcare workers?
That's a good question. It's interesting how complicated a surgical mask or an N95 mask can be. The raw materials from which it is made are not actually made in Canada. There's 1 or 2 locations that you can get it from in the States. So at the moment, researchers in engineering faculties, not just in Newfoundland and Labrador, but across the country, are trying to find alternatives. They're building a supply chain from nothing. So masks are actually quite a challenge. Gowns are a little bit more simple in the sense that once you've got a standard of fabric, it's a question of permeability and those kind of things. Those tests are relatively straightforward. So it will differ for different pieces of equipment. And certainly that has both our healthcare experts and also significant engagement from private entrepreneurs in the province working on it. I think it would be very difficult to give you a time on that, but I think everybody understands the urgency of this. We can buy them time by keeping apart. We delay the arrival of the surge. That gives them time to do their work.
If I could, we put in place good neighbor agreements with many of our our labor unions within Newfoundland and Labrador has various people with jurisdictions that would work, would coexist within the units as we provide health care. Well, a very similar arrangement, even though not formalized. There's a commitment from every province to actually share the information of locally made goods that we could actually share. And we've seen some of that already when certain provinces have been struggling and in need for things like PPE. That provinces have stepped up that may have a little more inventory, and they've shipped that to other provinces. So there's a good collaboration now amongst provinces in a very neighborly fashion that if they have something and someone else needs it, well, they're willing to share. And of course, likewise, we would actually be doing the same thing again if we had the capacity to do so. So it's just not what we can make locally. That's extremely important as we get into the manufacturing era in Newfoundland and Labrador. But it's important that we also let our neighbors know that we're able to do that and maybe support them in the future as well. But the key here is make sure that when we make this stuff, we make it to it meets the specifications so that we keep our healthcare workers safe. We want to do it here, but we also want to be able to be in a position that whatever we do here is keeps our healthcare workers safe.
Operator, we will now start single question.
Oh, I didn't get my second question.
Oh, sorry.
Yeah, sorry. I know it went on a bit long. I'm curious also, Minister, you mentioned that a few moments ago that we have about a week to 10 days of PPE in the province. So under these circumstances, what is the ideal amount that we'd like to have to burn through?
We would like to know that we could withstand a shipment that was late or a surge within acute health. This is why we have spent considerable time and effort with our healthcare workers and their representatives looking at what is best practice, what is the right mask for the right worker and the right patient in the right situation. And there is a lot of evidence out there to guide us. The challenge is that when people are worried, and healthcare workers are no different than anybody else, they worry as much, maybe more than others. There is a tendency to follow the heart rather than the head, and we have really been keen to use evidence. It's our only defense, and we're working through that. We would like not to have to worry about checking our supplies every day. But until we get to that point, we will check our supplies multiple times every day.
Thank you.
We will now move to single question.
Thank you. The next question is from Kellyanne Robert from NTV News. Please go ahead.
Thank you. I've been asked this question extensively. I'm wondering if we can get an age range of those that are in hospital.
We can provide that for you. We currently only have an age range for the positives. That's 5 to 91, and the median age is 55.
Thank you.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
Just going back to the question of testing, I'm talking to people who have symptoms right now. They've seen a doctor. Family doctors can't do the test and have to refer this to public health, but public health is telling them they don't meet the criteria because they didn't travel or they haven't had contact. Why aren't we expanding those criteria to include anyone who has symptoms?
So we are, as I said before, looking at the evidence to decide and analyzing our data to find out when would be the best time to do that. At the moment, the biggest risk factor that we have are anyone who has symptoms, who has been a contact of somebody with COVID-19 or has traveled. As if our analysis of the data shows us something differently, then we will change our testing recommendations based on that information.
The next question is from Patrick Butler from Radio Canada. Please go ahead.
Hi, I have a question regarding expenses for the province. Has government instructed staff to start curbing expenses or expenditures? Is there anything like a hiring freeze in place or something like that because of the difficult economic situation you're in?
Well, what we've been put in place is making sure that we redirect as much money as we can into the healthcare system. Of course, this is our priority right now. It's the priority of every single department. And as you've seen, just when we opened up the House of Assembly, there was a $200 million contingency fund put towards COVID-19. So if we obviously travel right now, we'll use and redirect and save money in those areas, and if need be, that can be redirected to health. But our in hiring freeze, right now we have many people that are working from home, so there's really no need at this point to be hiring people unless they're essential individuals right now. So there's no government-wide hiring freeze that's put in place, but we expect people to use the financial resources that they have available to them, to use that wisely, only if it's necessary, and if need be, we need to continue to position ourselves to put more towards healthcare if required in the future. Right now, as the Minister has said, as the Chief Medical Officer has said, our number one priority for me as Premier as well is stopping the spread of COVID-19, as it is for every other minister and our caucus.
The next question is from Holly Mackenzie-Suter from the Canadian Press. Please go ahead.
Hi, question for Minister Haggie. I'm wondering if for smaller provinces like Newfoundland and Labrador, do clustering events like the one we've seen coming out of calls pose a special risk for smaller provinces, just because we don't have a large number of ICU beds in case there's a sudden concentrated influx of patients?
We actually, as a province, are very well off for ICU beds per capita. If you look at our infrastructure, the 98 beds that we have compares very favorably with a lot of other jurisdictions. And we actually have more ventilators per bed than a lot of other American jurisdictions, which are often held up as the way to do it. I think the clustering is a feature of our geography. We have a wide, large province, but people live together in relatively close proximity where they do. So the calls cluster effect here is still significant. It's still of the order of at least 143 of the patients in Eastern Health. So it's a significant chunk of that. But in terms of infrastructure, we actually shape up very well on the national and international stage.
The next question is from Peter Jackson from The Telegram. Please go ahead.
Hi. I'd like to follow up on a couple of earlier questions about testing. And I just want to make it a simple question. If you have any kind of flu-like symptoms, does that automatically qualify you for testing?
At this point, no. What we are asking is if people, what we are testing or who we are testing, if people have a known contact with someone who has a diagnosed case of COVID-19, if someone has some other high-risk exposure, such as travel, then they will be tested. As I said, we have to look at our epidemiology and our data to inform that testing strategy.
Thank you.
The next question is from Tyler Dunn from VOCM. Please go ahead.
Thank you. Why aren't businesses who've had confirmed cases of COVID-19 shut down immediately for cleaning, such as the Dominion on Stavanger Drive, for example?
Well, businesses, take the appropriate decision, as they should, to allow time for cleaning, to make sure that people can go in there and make sure that the place is ready to be open. Of course, it's the prudent thing to do. It's the responsible thing to do, and making sure that you get an opportunity to reaffirm, I'm sure, that the importance of physical distancing. And so we've seen examples. I think you just described one. You just identified one. They just recently, and they took the opportunity to close their business, clean it up before we went back in, before they open it up again. That's the prudent thing to do. It allows public health to also do their work in contact tracing. The minute you find somebody that's in that situation, of course, it's important that you reduce the exposure and to make sure that you get your premises as clean as possible. I don't know if the Chief Medical Officer would like to add something to that, but I mean, really it's about getting the place cleaned up before you put more people back in there.
Yeah, and the contact tracing of a confirmed case is the most important thing that we do to remove anyone who may be at risk from being able to spread the virus. So, finding the people who are positive, who are in contact with that known case, is very important. So,
the next question is from Peter Cowan from CBC News. Please go ahead.
What's stopping us from expanding our testing criteria to include everyone who has the symptom?
At the moment, there's not really anything stopping us. We're trying to use the best information and the best science that we can to inform our decision making, to make sure that we're using our testing equipment, reagents, and testing kits appropriately and judiciously. So, and when we need to change that, we will.
The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Are abortion services during COVID-19 deemed essential, and are they still going ahead at this time?
Yes and yes.
Thank you.
The next question is from Patrick Butler, Radio Canada. Please go ahead.
Hi. You just mentioned about about the age range. There's a child who's 5 years old who's been confirmed positive for COVID-19. Can you give any more details about the very young patients and what sort of measures differ when you have cases confirmed that are so young?
Young children generally tend to do fairly well when they have COVID-19. Of course, some of them may get sicker, but for the most part, I think the children that we've had who've been infected here, have tested positive, have mild disease. Some of them have very few symptoms at all, and they've done all quite well up to this point.
And I guess, too, when you think about building on what the Chief Medical Officer said, as the individual that I just described, in my opening comments, it's not necessarily because you're 5 years old, doesn't necessarily mean you can be vulnerable. And some of our youngest that we have in our society can be very vulnerable, so we must do what we can to protect them as well. So we just cannot assume that because they're 5 years old, they're not vulnerable in our society, and we must make sure, as I said, to support them against the spread of COVID-19.
The next question is from Peter Jackson from The Telegram. Please go ahead.
There's been some word that transplant surgeries have been scaled back in Toronto and I believe Halifax as well, which is where the transplants from here are being done. Does that mean that there are people who are going to be expecting longer waiting lists here for transplants?
That's a very good question, Peter. I know that, in actual fact, Ontario has scaled back on pretty well everything except emergency admissions at the moment. We do not have the ability, the critical mass, or the infrastructure to run transplants here. We are totally at the mercy of other jurisdictions. So whatever decisions they make will impact us. And I suspect that there may well be, particularly for paired donors rather than the cadaver donors, a moratorium or a delay. I can certainly check on that. I'm just working on what would be a prudent triage approach.
The next question is from Peter Cowan from CBC News. Please go ahead.
A non-testing related question. We've seen the United States block the shipment of N95 masks to Canada. What sort of challenge does that present, and will that affect our supply?
We have a supply chain that depends on global sourcing, Peter. I couldn't tell you where particularly the manufacturers of our current orders would be. I do know that there is legislative ability for the President of the United States through a thing called the Defense Procurement Act to sequester products the feds deem essential there. I also know that 3M feel that for healthcare industries outside of the U.S., they feel obliged to honor their existing orders and their existing commitments. I couldn't tell you what the impact would be to Newfoundland and Labrador. We'll certainly have our people working on that because that news came out fairly late today. I think 3M did also make the point that if there was ever a tit for tat there, that could end up damaging the states as well. So it's an interesting situation which has not yet been resolved.
The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. For decades, Eastern Health maintained a pandemic warehouse. What has happened to those supplies? Are they currently in use?
We had pandemic supplies, and like a lot of other jurisdictions, some of those have expired. My understanding is that what is left in there that is usable will be diverted to the current pandemic. What the state of inventory was at the time the pandemic started, I couldn't honestly tell you.
Thank you.
There are no further questions at this time.
Thank you very much for attending. Tune in tomorrow at 2 p.m., 1:30 Labrador time, and we'll have you all back then. Thanks. Bye-bye.
Thank you. The conference has now ended. Please disconnect your lines at this time, and thank you for your participation.